Namaskar, myself Dr. VIPUL GURJAR. I am the head and professor of Department of Surgery in Sumandip University, Vadodara. Today is 27th December 2024. Today I am going to discuss about the piles surgery. That means a different type of surgery is available, and now the surgeons are confused themselves which surgery is good and which surgery is required for the pile surgery. Before that, I am disclosing that this is my experience only. I am not pointing out to any surgical procedure about your hemorrhoidectomy, Chiute procedure, MIPA, star procedure, laser surgery, or L surgery. This is my experience that what I am sharing with you. Even there is no documentation about this choice of surgery. Even there is no evidence like a journals, and it is established for this type of opinion also. So this is solely my opinion about the piles surgery. Okay. Now, once the patient is coming to you, everyone is asking which surgery is suitable for the pile surgery. Okay, no, it is a wrong statement. That means there is a one surgery cannot be satisfy each and every piles. Okay, it's depend about the patient. That means how the patient is complaining. What are the complaints? Is it related with the bleeding only? It is related with the pain? Is it related with the prolapse? It is related with the constipation. That means evacuation problem. Second thing, on examination, it is associated with the external prolapse. Is it associated with the on a per digital examination internal mucosal laxity? It is associated with the vaginal rectocele. It is associated with the any fissure. It is associated with the circumferential internal what, as well as surgeon's experience with surgery. Are you able to do the MIPH? Are you able to do the star procedure? Are you able to do the laser? Then patient's demand. Sometimes patient is not ready for the star procedure because of the finance problem. Sometimes patient is not ready for the old and gold standard hemorrhoidectomy because of the fear of pain. Sometimes patient will say that I am not trusted in your new technique about the laser surgery. So everything should be a compile, and then you do your pile surgery, because there is a lots of choice. Okay. Now the people are asking, why not the hemorrhoidectomy? Where is the hemorrhoidectomy, which is old and gold standard? Yes, hemorrhoidectomy is old and gold, but the people who is believing in hemorrhoidectomy, or the people who is doing only the hemorrhoidectomy, they are considering the piles as a disease. But according to me, piles is not a disease. First thing, piles is always a secondary to the some prolapse of a rectum, and this rectum is prolapsing due to the constipation. This constipation has a two part. One is the functional constipation, second is the surgical constipation, that is obstructive defecation syndrome. It may be a mild, moderate, elsewhere. So nowadays the new theory is coming up, because to solve this some part of constipation, and I also believe that patient has to be satisfied with both the thing. One is the evacuation, that is the constipation problem, and second is the bleeding or the symptomatic engorgement of a anal canal. Then we are able to give the nearby 100% result. Now everyone is understanding, or the surgeons knows that there is a fourth degree of piles, first, second, third, and a fourth degree of piles. But no, according to me, there is no fourth degree of piles. In a literature and in the book, they are mentioning the fourth, but in the practically everything is different. That means sometimes the patient having only single degree of piles, which is bleeding, which is not required any type of surgery, he may require only the conservative management. Second times, many patients are associated with the second degree piles. Sometimes patients are having internal external piles. Sometimes the patient having only the internal